All right, I guess we're gonna get going. This is such an awesome, weird space to be in, right? Because like some of you are here because you're excited to be here. Some of you thought you would get served a meal, or maybe there would be coffee, and there's not. I'm sorry. But really excited to quickly share with you our product demonstration. So I'm Brian Hart. I'm the founder and CEO of Halo Technologies, and we are a remote support platform for IDD provider agencies, mental health provider agencies, and behavioral health. And really excited to share what we do. We are an exhibit booth in the hall, so if you head over to booth, I think it's 306, we're in there. Also, tomorrow morning, we're doing a long-range education session from 9:30 to 10:45 that talks through more about how the technology could be implemented. So if you're thinking about, yeah, technology is great, but what do you do with it? We can talk through more about that. So I want to talk about who we are and why we exist. So our core founding team is made up of myself, Will Zell, who really runs our product and strategy, and Shivani Patel, who's our COO. And all of us come from a place where we looked around the world around us in technology, in disability services, and we decided it wasn't enough. We weren't going far enough. We didn't have the tools we needed. So often, technology is being built for those that are aging, those that are maybe in the school system, or those in the traditional, typical community. And then we have to figure out in disability services, how do we retrofit it back? How do we force it within our need? So we built Halo to really give IDD provider agencies the tools that they need to deliver their own remote supports. Why do we do this? Well, it's really simple. The open problem in IDD supports is that 88% of providers are presenting with staffing shortages, meaning that they have plenty of people that need support, plenty of sites to support them in, but not enough staff to provide those supports. We also know that 62% of agencies right now are turning away referrals. So even though they want to support more people, even though parents are desperately asking for someone to support them, the majority cannot take them on. We also know that the overnight shift, and this is that shift that is the hardest to fill and provides the least amount of value from in-person staff, can cost $30,000 to $50,000 per year per site. Again, think about that money that we are spending in a site where there's really nothing going on. My background is I have worked in IDD provider services. This is what I did for the majority of my career. I've lived it. I have been paid to sleep on so many couches where I was providing absolutely no value. I was getting no value out of it. Nobody was getting any value of it being there. And so what do we know? There are really three options for remote support. One, you can do nothing. You can have no technology and no remote supports. You can have staff in the home, they provide immediate assistance, but at the end of the day, they're not really providing the value you need, and nor can you scale. The other way is a lot of companies and agencies are looking at outsourcing their remote supports, meaning they're finding another company who has remote support technologies and a call center in some other state typically, and they're saying, you just handle this problem for me. And while that may be a great Band-Aid for now, in the long run, each agency needs to be able to provide supports to more people to meet the need that we have. And so the last model that we see a lot before using good remote support tools is a lot of internal teams building DIY tools, just piece things together. And that's what we had been doing for years before Halo existed. We would work with agencies to develop the model of remote support, and then when it came time to tech, we would start piecing it together. We'd say, okay, we need a screen to do face-to-face video calls. We need cameras to do camera activity. We need smoke alarms from this area, fall detection, medication dispensers. We'll figure it all out, we'll piece it together, but it wasn't a cohesive system. And that's where Halo came to be. The difference between us and all the other platforms out there is we really are there to empower the provider. We're not looking to come in and install Halo technology and use our staff to provide your remote supports. You provide your remote supports. You already have the staff. You already have the people that need support. We just give the tools to actually do it. The other thing is we have really seamless integrations around our technology. All the tools work together to provide meaningful support. So when you think about all the technology that could exist, all the problems that exist, there is usually a device that can solve for almost any need we can think of. As part of a demonstration that was done in the early 2020s, a study was done to look at what are the needs of the individuals receiving support. And through that study, we found that there were about 184 unique needs that were being supported through direct support. Out of those 184 needs, about 96% of those had a technology device that could support the person at that same level. The problem is none of them worked together. You were constantly trying to piece things together, trying to shove them in a hole that didn't work. The other thing we found is that when agencies were trying to adopt technology-based solutions, it was hard. The technology was the hardest part. And while it should be, with a drill in my ear, while it should be that the services should be the hard part of delivering remote supports, really it's the technology that ended up being the hard part. It was how do you install it? How do you maintain it? How do you get there? And so Halo is going to come in to take that off your plate. And the last thing is how do we reduce cost? Again, a lot of these technology remote support platforms that have come out, they exist. They include the same sensor. All of them include about the same sensors, same devices, but the pricing was outpricing what we could afford in the remote support model or in the IDD model. We know that Medicaid services are not continuously growing. In many states, they are being cut, nationally being cut, and even in states that allow for remote support and technology-based services, it's usually an underutilized, underfunded service. And so often what you have to do as a provider is look at your rate that you're being provided in other areas and find ways to use technology supports to augment or support them. If you're paying several $100s per month per person to do this, it just doesn't make sense. And so with Halo, we have found a way to bring all this to table and do it in a way that helps the agency actually get a higher end of revenue, even if they're billing less, while they're supporting more people and using less staffing. What it does is it combines really 3 key areas. One, modern smart home technology, and this is the basic hardware that you would use in any type of smart home. The things that we would do is if we had staff in the home, we want to know if there's a fire. We want to know if somebody's coming through the door. We want to know if somebody's up in the middle of the night. We want to know if they've had a fall, if they need a medication, all of those areas. We've combined all those technologies into one place to give the staff the tools they need to provide support. These are driven through an operation plan and alert model that allows the staff to not just know that something happened, but what to do with that information. Because just knowing the smoke alarm went off at Brian's house at 2 a.m. is not enough. Because not always do we want to just say, hey, the smoke alarm's off, you better go to the street and call 911. Because sometimes I just put 20 minutes on the microwave to cook popcorn instead of 2. In that scenario, we would want to know that's happening, call into the person, tell them turn off the microwave, maybe wait for it to cool down, open a window, and move on with your life. However, we also want to know that if there is a fire, we can get somebody out, we can check every room, and we have called 911 at the same time. We also want to make sure that the platform is built for purpose-driven remote support. So again, it's not just waiting for things to happen, but also reaching out to people, to knowing, hey, it's 2 o'clock, and usually at 2 o'clock, that's when Brian's bus picks him up, and that door has not opened in the last half hour. We should probably make sure that he's up, that he's ready to go, and he's out the door before that bus just leaves him. And then lastly, how do we report and learn this back to our agencies? Being an IDD provider that bills Medicaid, we have to document the heck out of everything we do. And when we're working with 20 multiple platforms, that means we have data in 20 different sites that we somehow have to combine to bill and document. With Halo, we take all this information, we put it in one place and allow you to easily export it so that you can use it for billing purposes, charting, incident management, all of those different areas. So let me show you what our Halo platform looks like. And the way we got here was not because those of us that were in tech or in disability thought we would just build something that looked pretty for us. What we did is we realized that those that were delivering services and those that were receiving services should drive what the products they're using look like. So we found 8 IDD and mental health providers that were already doing remote supports with other tools and said, will you just give us advice? What do you like? What do you not like? What's working? What's not working? Then we found a bunch of individuals receiving supports. And we asked them, what do you like about remote supports? What do you not like about the technology? How do we build this for you? And then we went to the agency leadership and said, what is making your life hard? How are you getting through this? And that's how we built Halo. And this is a live version of a demo site. You can see where it says Brian's house. That is my house. You can come to my house if you want. It's pretty public record. I don't worry about putting my address out there. It's in the phone book, you know, whatever. But here's where the remote support professional log in and see the sites they're assigned to. One of the things we heard from the professionals is I was always worried tech wasn't working, and I would have no idea of knowing. Without going device by device by device by device, how do you know what's down? With one click here, you can see really easily which site is probably okay and which site is not. Pretty easy to see it's Riley's house, something's going on, right? There's a red dot next to that site. There's not one next to Brian's house. And when we log in to look into Riley's site and you click into it, you can see we've got devices offline, tablets are unavailable, it's not working. Again, from this dashboard, the individual that's providing support can see immediately what do they need to do to provide support and what are the areas in which staff can provide meaningful guidance. You also can look and see what alerts are coming through. These alerts are based on operation plans that are developed as a team, and we mimic what would staff do if they were in the home. So the in-person staff use a tool to identify what would you do if you were there, and then we replicate that with technology. So if it's the middle of the night, and in the middle of the night if there's motion in the living room or you hear a noise in the living room and there's staff there, they would go in to see what's going on. And they would say, oh, it's Brian, and when he's up at night, he causes mischief. We need to provide support. Or it's Zach, and when Zach gets up at night, he goes to the bathroom, goes back to bed, we don't even do anything. Well, the technology will drive that same process, and you'll see that here. When an alert comes through, it would actually come through as a pop-up that would show on the screen just like this. You would see that it's in progress, it's a critical alert, where it's at, that in the kitchen we have motion when there shouldn't be. Here you can also link their direct operations plan. This would be a live document that the staff would constantly be updating that would document what do you do in this scenario. In this plan, if it tells me to view a video camera feed, you would click right there to view the camera that's tied to that room. Again, it's in the kitchen. Let's say the smoke alarm goes off in the kitchen. We can view the camera feed. It comes on for about 20 seconds. It does not record. It's not actively monitored, but it can be viewed in time. And you can see, do I need to call the person and tell them on their tablet, hey, unplug the microwave or turn off the microwave or pull out that fire extinguisher we're required to have and nobody seems to know how to use? Or is it, hey, there's an actual fire there. We need to get everyone out of the house. We're going to video call all the screens, send a message, make sure everyone's out. You can either view the camera feed or call the tablet right there. When you're done with your support and you resolve it, it immediately pulls up an area where you are required to do a chart note, document your work, which is saved and noted for the staff for later. Again, this way, all of your documentation is kept right here in the platform, and you can use it and share it. You can also reach out. You can start a chat. Let's say we want a video call. Your remote support is a face-to-face, in-time support. It's as close to in-person as we can possibly be without physically being there. So we want a video call with someone. We choose a site. We choose the place. We choose the screen. We hit a video call. It directly video calls that screen or tablet. On the other side, the individual can do the same thing. They need their staff. They, with one button, hit call staff. It knows who to call, who is working with that person at that time. Again, as a provider agency, you're not setting up a massive call center with 40 people working in a room, taking calls from around the country like you're the Sears Repair Center. And anytime a new person calls through, it gives you a few basic demographic information. You've got to figure this out. In our model of support, it's a caseload with a small group of people you're working with, where one remote support professional is working with anywhere between 5 and 8 sites at a time who they know just as well as the people in the house would know. They check in and talk with them every day. They know their support plans, so they can video call with them. You can also force a video call in times where it's needed. Let's say that we get a fall detection alert in someone's bedroom and we video call with them and they don't answer. Do we just walk away and assume they're fine? Well, what would we do if we were in the home? Let's say we hear a crash in somebody's bedroom and we're providing support. We knock on their door, they don't answer. Do we just walk away as support professionals? No, we are going to go into their room and see what's going on. Do we need to file an incident report of why we violated their privacy and went in the room? Absolutely, but we're still going to provide support. The same thing happens here. You can also do a chat message. Let's say that maybe somebody doesn't like to video call as much, they want to just send a message back and forth. We can chat with the people through text back and forth. They can send messages back and forth, but we can still do a call right from there. We also can do things like caseload management. You can manage your remote support caseload here. This is how you assign the sites in the case so that when somebody hits call staff, it knows where to go. No longer does the individual have a flat list of people who work with them and have to decide who's working at that time and who should I call. Do I call Debbie today or do I call Brian today? Is it mom? Who do I call? By this caseload management tool, it directs all that for you. Again, the whole idea behind this is how to make this as easy as possible for the remote staff to provide support. On the resident side, this is what their side looks like. Now, it's hard to visualize a tablet. If you want to see one that's not have a little bit of Latin in it, we have one at our booth. You can play around with it. You can video call with it. But this is what it looks like. And you can see that it's simple. It is simplistic by design. When we worked with the individuals that were receiving support, we asked them over and over again, what do you like about your remote support device? What is not working on your tablet? How does it work? And what we heard over and over again is when I need support, I have to muddle through a bunch of different apps to find the one that I'm supposed to use for support, or I don't know who to call. I don't know who's working, or I don't know if I've missed a call. We also heard that people really what they want to know is what day is it, what calendar events do I have today, and what is the weather like? That gets me out the door. And so that's what this has there. When someone hits this call staff button, it doesn't open up a menu of people who they could call. It calls the person that's assigned to work with them at that moment. Again, providing a higher level of care, but then also that we're not duplicating 10 people working with the same person. Because we all know if we assign 5 or 6 people to cover the same site in remote support, nobody's covering them for remote support. That's the reality of how this works. So what we have right now, again, in our base platform is we have all the basic integration devices of remote supports. We started developing this platform about a year and a half ago. We are fully up and running. We're in multiple states. And we have integrated all the basics. We are on the process now of adding what we call Halo Health that will include things like fall detection, medication administration, passive health monitoring right in the platform. Right now we do those with a split screen where you'll just have them split on the screen. Eventually they'll all be driven by one seamless process. The last thing that I talked about was cost, right? And I'm about as upfront as pricing as we could possibly be. And one of the things that drove me to want to work with Halo and to found it was we don't just want to solve technology for technology's sake. And we don't want to do it just to enrich technology companies or to build out providers. We want to do it in a way that serves the needs of everybody. We need to serve more individuals in a more independent way. Agency providers need to be able to provide more services. The only way they can do it is if they bring in more revenue. However, the only way most providers know how to bring in new revenue is to lobby with the legislature to get higher rate increases, which is long and doesn't go very far and doesn't actually solve the problem. But we know that with remote supports, when you switch to a remote support model, when you have remote support staff providing it to multiple people at your agency, while maybe your billable may be a little bit less, and likely will be, your net revenue actually goes up once you hit a meaningful scale. A meaningful scale is not huge. You break even at 3, you start making money at 5, and you are at a meaningful scale at about 10 individuals, 20 individuals at that area. For our pricing, it's very straightforward. It's not billed by the device. It's not, hey, if someone has additional needs, they're going to have more pricing. It's really flat based on how do we support the best people. There's a one-time fee that gets everything started for your agency. Not per site, not per state, just to get things licensed, to get everyone trained, to teach you how to run this. And then for the resident, it's just a flat $65 per month. It doesn't matter how many screens you may have. We're not charging by the screen or by the camera. It's just that $65 a month. And then the hardware is a subscription model that is future-proofed for your services. So it's a flat rate annually that includes all the base technology you need. And what do we know? We know that all the technology that we're seeing here today, if we come back in 5 years, that room over there is a room full of VCRs, right? It is going to be outdated. It is going to look old. It is going to look clunky. And the last thing anyone wants to do is buy a bunch of technology and have it be outdated. And so with Halo, you pay by the year, and then as things get updated, we just change it out. As things die, we replace it. Again, making technology the easy part for your agency. You provide the support, we'll provide the technology. So that's it. Our mission, and we are a mission-based tech company, and our passion is to provide the tools that agencies need to provide supports to more people. This was not driven out of an idea that we had because we are a tech company. It is driven by people who literally have worked in this field, who have spent 15 years of our lives sitting at agencies wondering how are we possibly going to support more people. As our population ages and their parents and caregivers age, that message is only going to get harder and harder to sustain. We have to do things now. And as a provider, you can either choose to adopt this now, when it's maybe a little harder, or you can choose to do it in 5 years, or you can choose to do it in 10 years. But I think in 10 years, if you've not figured out how to pull remote supports into what you're doing, you likely are not going to exist anymore, because that is an inevitability of change that we're going to see in our market. So thank you so much for letting us join you today. Again, this is a quick 20-minute product demo that we could do. If you want to learn more about it, booth 306 in the exhibit hall tomorrow, 9:45 to 10:45, we're going to be doing a larger education session that talks about not just how do you get the technology in, but what is the process that as an agency you can go through all the other pieces. How do you do the culture shift? How do you get buy-in from your staff? How do you do the right assessments? How do you make sure it's funded? How do you get every single piece in place? So again, you can build a remote support system and then move on to just providing great supports. So thank you so much.